Good day, I am Maria Ana Katrina Pagao from BSN 111N, and now I am going to perform assessing the cardiovascular system return demonstration. First, review the patient's previous medical records and also check the doctor's order for the need to perform the assessment. And then after that, prepare the necessary equipment. This includes the pen light, a short object, and also this stethoscope. And then after that, greet the client politely and also the patient's companion if around. Introduce yourself and verify the patient's identity. Also ensure the client's safety, confidentiality, privacy for the comfort of the patient. Good day, sir. I am Maria Ana Katrina Pagal, your student nurse for today. And may I see your wristband, sir? Please state your name,
Jason Siban,
your age,
20 years old,
and your birthday.
March 11, 2003.
Okay, now sir, I am going to assess your cardiovascular system, and which means that I'm going to expose your abdomen area. Will that be alright? Now stood at the right side of the bed and position the client in a supine position, and make sure that the head of the bed is elevated between 30 to 45 degrees, and make sure that the head and the torso are on the same plane. And now instruct the client to turn the head slightly to the left and show tangential light onto the neck to observe for pulsations and shadows. Sir, can you turn your head on that side? Okay, thank you. And now, if jugular distension was noted, assess JVP by locating the highest visible point of internal vein. And as deemed necessary, raised or lowered the highest visible point until the distension was observed. Now measure the ventricle distance of centimeter above the sternal angle by extending a long object. Okay, and then after that, repeat the preceding steps onto the other side. For carotid arteries, with head of the bed still lightly elevated 30 degrees, position the client's head towards the side being examined, and then palpitate the carotid artery cautiously, avoiding too much pressure and massaging. And now, turn the client's head slightly away from the side being examined, and then place the bell of the stethoscope over the carotid artery and ask patient to hold his breath for a moment. Okay, sir, can you inhale and exhale? Please inhale, exhale, inhale, and then hold your breath. Okay. And then after that, repeat the steps on the other side. Now for the inspection and palpation, begin with general inspection of the chest wall, stood at the right side of the bed, and shone a light for pulsations across the chest wall over the cardiac apex. And And then simultaneously palpate, inspected the precardium for pulsations while palpating aortic area, pulmonic, tricuspid, and apical area. For thrills, press the ball of the horn firmly on the chest to check sensation caused by underlying turbulent flow. And now palpate impulses using the finger pads. And then after that, palpate the apical impulse using the palmar surfaces of 2 to 3 fingers. Assess the heart rate in rhythm. Place the diaphragm of the stethoscope at the apex and listen for apical impulses, and then auscultate the heart by the 4 anatomic sites. Now assess each arm for size, symmetry, skin texture, and temperature. Okay. And then inspect the peripheral veins for any presence or appearance of superficial veins. And then palpate for radial pulse, ulnar, and the brachial pulse. And then after that, assess for capillary refill. And then after that, perform the Allen test and repeat the preceding steps on the other side. Okay, sir, can you close and open your arms? Close and open. And now for examining the lower extremities, address each leg for size, symmetry, skin color, and temperature. And note for any lesions, skin texture, and hair distributions. Also inspect the peripheral veins of legs for any appearance of superficial veins. And then palpate the femoral, palpitial dorsalis pedis, and also the posterior tibial pulse. And then assess the peripheral veins for any signs of ulcerations and varicosities. Okay, the temperature and the skin color are normal. Now I am going to inspect the peripheral veins. And now I am going to palpate the 4 pulses. And now I am going to palpate the calves for calmness or tension of the muscles. And then after that, assess for capillary refill. Okay, sir, and now we are done in our assessment. Your findings are all normal, and also thank you for your cooperation.